Good afternoon, and welcome to this community briefing on our ongoing pandemic response efforts. Providing interpretation for us today, once again, is Margie Prop. Thank you, Margie, and thanks to all of you for joining us. The arc of this pandemic has been marked by pivotal moments, and in each of those moments, our community has responded with the best tools available to us. Our response has reduced illness, saved lives, and protected our healthcare system. In March of 2020, Lincoln saw its first case of COVID-19. At that point, the best tools we had to combat the pandemic were staying home and socially distancing. Our health team quickly implemented measures designed to slow the spread, and in April 2020, we asked the public to wear masks indoors in public settings. All of these actions helped flatten the curve. This past summer, we saw our first case of the Delta variant in Lincoln. At that point, the best tools we had to combat the pandemic were the vaccine and masks. Our community members rolled up their sleeves and protected each other and our hospitals. And as a result of our community's responses, we have weathered the pandemic better than most. According to a researcher at the Johns Hopkins Bloomberg School of Public Health, Lancaster County is in the lowest 10% for mortality rates and top third for vaccination rates when compared with hundreds of other counties across the U.S. with similar demographic profiles. Our efforts together have made a meaningful difference. Now, we face the next pivotal moment with Omicron. And here's an important way that the Omicron variant is different. It's more contagious, and fully vaccinated people aren't as protected against Omicron as they are against previous variants of COVID-19. Recent data from around the world has made one thing clear. The best tool we have to combat Omicron is getting a booster shot. Once boosted, an individual can expect to resume a high degree of protection from severe outcomes of COVID-19. Join the more than 84,000 people in Lancaster County, ages 16 and older, who have received a booster shot. If you are vaccinated but have not received your booster yet, this next comment is specifically for you. Get in for your booster now. Today, you can get a booster at the Lincoln Lancaster County Health Department, local pharmacies, pediatricians' offices, and community-based clinics. And to accelerate this effort, our health team is preparing now to stand up large-scale vaccination clinics. The booster is the best gift that you can give to yourself, your loved ones, and our community this holiday season. This is literally a call to arms. Here, with the latest update on our local situation, is Health Director Pat Lopez.
Thank you, Mayor. Before I dive into the indicators, I want to underscore that the data shared today reflect our local current surge of the Delta variant. Just before the briefing, we were notified of our first case of Omicron in Lancaster County. This was expected, and we are currently investigating. Now forward. In reviewing the 7-day rolling average of new cases, you can see what looks like a wave on this chart. The average just before Thanksgiving was around 100, before jumping up to 182 cases after the long holiday weekend. Over the past week, we've seen a decrease down to about 140 cases on December 17th. We hope this decrease isn't temporary, but our experience tells us that we are likely to have another holiday bump at the end of this year. With that, schools on winter break, families traveling, and an increase in gatherings, plus the likely arrival, as we've mentioned, of more cases of the Omicron variant. The positivity rate is still above 14%, which means the risk of transmission is high in our community. The number of COVID-19 patients hospitalized locally continues to be a major concern, one that impacts every person in our community. The 7-day rolling average of COVID patients has been increasing steadily from 98 in mid-November to 104 December 12th, and then to 120 on December 18th. Throughout this pandemic, we've seen a consistent pattern. A jump in cases is typically followed by an increase in hospitalizations, and then, unfortunately, an increase in deaths. Today, our local hospitals report 126 COVID-19 patients with 21 on ventilators. This includes 82 Lancaster County residents. And sadly, today we are reporting a death of a woman in her 80s. Our community has lost a total of 17 residents to COVID-19 in December. Then with the case rate, positivity rate, and hospitalizations remaining high, the risk dial will remain in elevated orange for this week. And as you know, orange means that there is a high risk of COVID-19 spread and impact on our community. Our vaccination, as the mayor said, remains our best defense against the virus and its variants. We continue to lead the state in our vaccination efforts. Almost 408,000 doses have been administered, and more than 203,000 residents have stepped up to protect themselves, their families, and our community by getting vaccinated. That's about 64% of our community residents who are fully vaccinated. About 71,000 people in Lancaster County are eligible for vaccines, but have not yet taken that first step. And it's important that they do so as soon as possible. Getting vaccinated reduces the number of cases, helps keep people out of the hospital, reduces the impact on our healthcare system and our community, and it saves lives. Our hospital partners, from them, we know that the vast majority of COVID-19 patients are unvaccinated. According to the state, unvaccinated Nebraskans are 10 times more likely to be hospitalized than those who have been vaccinated. Many of those in our hospitals would not be there if they had been vaccinated. State officials recently estimated that vaccinations against COVID-19 prevented between 1,500 and 2,000 hospitalizations in Nebraska and saved an estimated 500 lives from November 7th to December 4th. As a reminder, everyone age 5 and older can receive COVID-19 vaccine. To date, 20% of more than 5,800 children ages 5 through 11 have been fully vaccinated. If your child has not yet received vaccine, it's important that they be vaccinated now. On this chart, you can see the vaccination by age group. The light blue sections on top of the bars represent first doses. So you can see that people are still getting that first dose across all age groups, which is really great. The darker blue sections represent those that have completed their second dose, and that is also quite high. And the orange sections represent the percentage of people getting their booster, which is higher between 60 and 70% among those 65 and older. Everyone aged 16 years and older is eligible for a booster dose now. As the mayor mentioned, over 84,000 people have now gotten their booster dose to add further protection. If you have not yet received your booster, get it now. The clock is ticking. Yesterday, the CDC reported that Omicron is now the dominant variant, representing about 73% of cases in the United States. Even in this early stage of the Omicron wave, medical and public health experts agree on these points. First, Omicron cases will increase more rapidly than anything we've experienced in the past. Second, if you're vaccinated, you need a booster dose to protect yourself and others from Omicron. Third, if you're unvaccinated, you're at greater risk. Vaccine is your best protection against hospitalization and death from the virus. And finally, even if you've had COVID in the past, your natural immunity will not protect you from getting infected with Omicron. But getting vaccinated now will greatly reduce your risk of hospitalization and death. Higher vaccination rates can help slow the spread of the virus and help limit the number of variants that arise. Here in Lancaster County, we continue to offer many opportunities for our residents to get vaccinated to protect themselves, their families, and our community. The health department has vaccination clinics at our location this week and next. Walk-ins are welcome, or you can go to covid19.lincoln.ne.gov to schedule an appointment. After the first of the year, we will be working with partners to host several more large-scale clinics. Over the last year, we have made critical progress in protecting people from severe illness and saving lives. We are currently equipped with more tools and treatment options than before, and we are using them to reduce the spread of the virus and its variants. Last month, when we extended the directed health measure, we stated our intention for the mask requirement to remain in place one more month, to give ample opportunity for everyone eligible to get vaccinated or receive boosters. We specifically wanted to give parents and guardians the opportunity to get their children aged 5 through 11 fully vaccinated. We provided those opportunities, and the DHM will not be extended. This does not mean that the pandemic is over, and it does not mean no more masks. Masks work to reduce the spread of COVID-19. We strongly recommend people continue to wear masks indoors around other people from outside your household. We strongly recommend that businesses require their employees to wear masks. We strongly recommend mask wearing in schools. And we strongly recommend wearing masks at indoor sporting events, theaters, gatherings of groups indoors, including church and faith-based services. Many businesses and venues will continue to require masks to protect the most vulnerable and to protect their employees, and we ask the public to respect that decision. They are within their rights to require this without a mandate from the health department. You can expect that when you go into a doctor's office, a hospital, or a long-term care assisted living facility, you are going to be required to wear a mask. And if you use public transportation, you are also required to wear a mask. We also continue to urge you to get vaccinated or get your booster dose to have your optimal protection against the virus and help ease the severe strain on our local hospitals. And avoid the 3 C's, crowded places, confined spaces, and close contact without masks. Wash your hands regularly and get tested if you're experiencing COVID-19 symptoms or if you've been exposed to someone who has the virus. Testing options are widely available in our community, and you can find the locations at covid19.lincoln.ne.gov. And most importantly, stay home and away from others if you're sick. We know what to do. These are the steps that will protect you, your family, and your community today, tomorrow, and the weeks to come. Updated guidance will be posted at our website, covid19.lincoln.ne.gov. And if you have COVID-19 questions or if you're seeking general information and resources, the Health Department hotline is operational Monday through Friday from 8 to 4:30 at 402-441-8006. And with that, we'll take any questions.
Hi, this is Bailey with 1011. Was case numbers, hospitalizations still not really down extremely, and the Omicron variant on the rise? Just what's the justification for ending the mask mandate other than having previously said that it was going to expire?
I think I explained that in the remarks, is that when we extended the mandate earlier this month, or last month, we stated that it was to allow everyone to get vaccinated and for our 5 to 11-year-olds to get vaccinated as well. We've allowed for that in the community, and we're continuing to offer those options, and we need our community members to step up and do what needs to be done.
Zach Hammock from the Lincoln Journal-Star. How should schools in the county approach masking when they return from winter break, especially considering that many children aren't yet vaccinated? I know that you said that you'll strongly recommend masks in schools. Is that the new guidance?
We strongly recommend. We've spoken with all of our school administrators, and they're aware of the plan. They will work individually and together with us, as we have done during this entire pandemic. And I think the important thing is that, you know, the mayor related this as a call to action. Everyone over age 5 has an opportunity to be vaccinated, and especially our school-age children. When you're vaccinated, you don't have to be out of school to quarantine if you're a close contact. You simply need to wear a mask, get tested at day 5, and if you don't have, and go about your normal activities. And if you're not symptomatic and you don't have a positive test at day 8, you're not wearing a mask anymore.
Do you believe the mask mandate impacted our case numbers when it's been in place over the last several months?
Yes, I think it has, and I think we provided information previously about the impact on our deaths and our number of cases here. And so, yes, I definitely think it has provided that. But now at this point, we need people to take action, as I keep saying, and for the good of the public. As a community, we all have to be working together, and our best tool is to get vaccinated and to wear masks when we're in indoor spaces.
Mark, KLI Radio, Pat. Question goes back on death reporting. When the deaths were initially reported, it was included whether there were underlying health conditions, comorbidities, that type of thing. That's no longer given. Is that a possibility of getting that information reported back again? And then I have a follow-up.
Sure, we can look at that, Mark. And in general, I have to tell you, many of our cases are individual, when we're reporting deaths, are not individuals with underlying health conditions. But we can sure look at that again.
All right, appreciate it. The other question is, the governor and Dr. Antone yesterday were talking about treatment options and the fact that this virus may not go away soon, or for that matter, ever. Will you ever be including treatment options? Some of the antivirals that Dr. Antone said, well, they hope they'd be approved by the end of the month. The monoclonal antibodies. Will that those treatment options ever be included in your data analysis for further directed health measure recommendations or any other of your analysis?
You know, I actually talked all the time with our primary providers of those. And with the Omicron, there's a different monoclonal that's being used, and there'll be more information available. We're going to have a limited supply in Nebraska. We work very closely with our physicians and the Lancaster County Medical Society to provide all the information out to them. And I'm sure I can certainly get you the information, but we generally provide over 1,000 doses in our community for the monoclonals. We had a little bit of a shortage here a couple weeks ago, but that's reversed itself. But what we found with some of the monoclonals that's been really effective with the Delta variant, that's a little bit different with Omicron, and that's another reason for people to take action and get vaccinated as well.
Are you getting any information on the possibility of getting these antivirals that they get approved, that they'll be readily available quickly?
That's another great question, Mark. You know, we have one that's being approved by Merck. We still haven't gotten the number of courses we're going to have for Nebraska, but it will be a very limited supply. We're still waiting approval on Pfizer has a medication, and AstraZeneca has a medication that should become available for those with severe immune compromised situation, such as people who have had transplants, those receiving chemotherapy, and other illnesses similar to that, as you can imagine. And that's more of a preventative measure for 6 months, but none of these things are readily available yet in the community. So that's part of the reason why I haven't mentioned them so much yet, until we get more information about what's going to be available right here for people to know about.
As those come in and become treatment options, you will be including that in your analysis of data in the future at some point.
And we look at all the data that's available now in the monoclonals to prevent severe illness, and we do know, I shared some of what they've seen from a statewide perspective on the prevention of death from monoclonals. So yes, we will be able to share more information.
Hi, Pat. It's Matt Renee with the Journal Star. Hi, I've got a couple questions for you. First off, do you have any additional information you can provide on that Omicron case in the county, such as an age? What did the person travel, or is this a suspected? Did they have exposure to somebody else that had it?
You know, Matt, I wish I had that for you, but we were just notified of the case, and our team is actually actively investigating now. When we have more information available, we will absolutely release that to share with you all.
Okay, great. Another question I have, obviously we have a group, kids ages 5 and under who can't get vaccinated yet. What kind of advice would you give to parents of those kids, or to daycare providers, or anybody that's around that group often?
We're actively working with the child care providers, as we have all along, and as our department does anyway, and that's part of the work that we do. But I think it's really important for parents to do as much as they can to minimize the exposure for those that are under 5 and can't be vaccinated. We are encouraging the child care centers to continue having masking available, and we're working through some of those recommendations very actively right now with them, Matt, and what kinds of options they could have when they do have situations where they may have a positive case or so in a room, as they refer it to, and then how could we maybe cohort some of those so we can keep parents being able to work, and we can keep our centers moving forward. So that's a work in progress right now.
Okay, and then just one more question for you, and this kind of goes back to the decision to end the mask mandate. And I know that you guys had said last month that you planned to keep it for another month and give people time to get vaccinated, and then it was likely to go away. But you did sort of have a caveat that unless things changed, and I guess I would think that Omicron's a pretty big change. You have a more transmissible variant that the vaccines don't offer as good a protection against. So, I mean, kind of talk to me or explain how that figured into your decision to still go ahead and let the mandate expire.
We expected Omicron to come here. We're usually a few weeks behind what's happening in other areas as it moves towards us. And those are all things we considered. And I appreciate you asking that question so I can clarify. You know, we are not extending the mask mandate today, but it is one of the tools that we have available to us, and it does not mean that there won't be other times when that's what we have to do for the protection of our community, as well as looking at other measures that have to come in place to help us get through various situations. I think this is something we have to understand, that we are going to see variants, especially as long as we have so many people who are not vaccinated. That's how the variants happen, and we're going to continue to be facing that. So at different times, we're going to have to employ different measures to get us through a particular situation. And right now, what we're trying to help people understand is that they have the power and they have the tools that they can personally use to make a difference.
Did mask fatigue or trouble with businesses having to try to police this figure into that at all? That decision at all?
No.
Okay, thanks. That's all I have.
This is Bailey again. One thing I'm looking at today is just comparing different cities similar to Lincoln, what their mask mandate policies have been like, what their case numbers look like. Is that something that the city does or the county does when making decisions like this?
Of course, we look at what's happening here. We look at what's happening across the country and what kind of efforts are being put in place and what the conditions are when we're making decisions. But I just want to make it clear that, our concern is what's happening in our community first. And we look at what's happening all around us, and we make those decisions based on what's happening here and how we can best protect the members of our community.
And you talked about different tools. As far as masks versus vaccines go, have vaccines, you believe vaccines are more helpful than masking is?
I think that, I've been really clear that vaccine is the critical tool for all of us to prevent serious illness and death. And masks are one of those non-pharmaceutical things that we can do when we have to protect ourselves and others around us. So masking is a tool that we have. Vaccine is a critical element that we have to have in place. And masking will be something that we'll see off and on throughout our time in working with this virus. Masking does not take the place of a vaccine.
This is Zach from the Star. I had one more question. I know you mentioned that you meet with local school leaders. How does their input factor into a decision like this, knowing that now they'll have to make their own decisions on whether they'll mandate masks in schools?
Zach, we don't, I just want to say, this is a health decision, and the schools rely on us to provide them the appropriate health information for their decision-making, and we do work together as a team, but our role is to provide them with the appropriate health decisions, and we do make our decisions based, again, on what's best for our community.
Okay, thanks.
Mm-hmm.
Mark Vale, give Caroline with another area. A week ago, or maybe 2 weeks ago, you had Russ Grunwald and Derek Vance on a news conference talking about the critical shortage of staff and staffing beds for everything that's going on in those hospitals. Going into the hospital week, can you give us kind of an update on whether that's easing a little bit or staying really tough? And has there been any thought about doing like some other states and asking the governor for some support from organizations like the National Guard, if that is still a critical issue?
Mark, thanks so much for asking that. Yes, the mayor has visited with the governor probably 2 weeks ago about using the National Guard to especially assist us in getting long-term care residents or individuals that need long-term care out of the hospital when they no longer need hospital care, and that the National Guard might be a resource for staffing those facilities when that's a problem. Primarily, St. E's has had some issues with staffing. Bryan, in general, has not. But the situation that Director Vance and Director Grunwald explained to you last week is still continuing. We saw a brief improvement, but we continue to be, like today, at 126 cases. There are people in the waiting room, in the emergency department, waiting for a bed, and we're still working through some of those issues, but we've tried to do everything we can to implement. I've spoken with Dr. Antone and with his staff at DHHS to see how we can facilitate opening up more beds for those who need hospital care and moving those out who do not need hospital care. Not that that's going to solve everything, but, right now, today, I think we have almost 30 individuals that are in that classification. Well, that's 30 beds. I do know that we are experiencing situations where people are being taken from our community to other areas. One example that was shared with me was somebody who had a workplace injury that required, it was a critical situation, but they could not get care in Nebraska. They could not get care here, and they were life flighted to another state to get that care. So yes, we see that happening. And that's why our hospital administrators, our physicians, and our health department is asking people to step up and get vaccinated.
Yeah, that's got to be really tough going into the holiday weekend. So thanks for the update.
This question is from Fred Knapp. Is there evidence one way or the other whether having had a mask mandate in place has made Lancaster County safer than other counties in Nebraska that did not have one?
You know, we didn't have any schools closed down here. We haven't had some of the other experiences other counties can have. Can I give you an exact number of what the mask mandate has meant in terms of that? I think what we've showed you is the number of cases over time and the number of deaths that we have that is somewhat different from other counties that haven't had a mask mandate, not just somewhat, greatly different.
Okay, another.
Donna with Channel 8 real quick. I just want to make sure the timing is correct. Does the mask mandate end at 11:59 on December 23rd?
Yes.
Thank you.
We have another question that came in on chat. Do you have any information on President Biden's promise earlier this afternoon that in-home tests would be available to everyone or that rapid tests will be mailed to people?
Nope, we have no information on that right now. And as we get more, we will certainly share that. We're awaiting more information.
I have one last question. This is Bailey. Obviously, it's you're not making decisions to please people, but no matter way, if you have the mask mandate or don't, some people will be unhappy. Can you just talk about what it's like to make a decision like this when you know that opinions will vary widely on it?
I think the most important thing is to make the decision based on the best information possible, use all the resources that we have available in informing us and looking at that decision, and to do the right thing for our community, what's in the best interest of keeping community members safe and allowing us economically to move forward and for people to have the resources they need available. All those things, it's a very difficult process looking at all the data that's available. And that means not just here locally, but nationally and other parts of the state, consulting our folks at the Global Center in Omaha and other infectious disease experts that provide guidance to us, as well as our own local physicians. It's a really difficult choice and a difficult process in coming to that. But our goal has always been and will continue to be that this is a health issue and we need to address it as such and we need to do the right thing.
Pat, one more quick question. With our hospitals continuing to be stressed, is flu starting to become a factor? And in addition to getting vaccinated, do masks also protect against the flu?
Well, what I can say is we had 21 cases of flu last year, and we have over 78 so far this year. I think masks do help, but so does getting the flu vaccine. And primarily what we're seeing, the largest number of cases are between the 16 and 24-year-olds right now. We don't have any cases of individuals being hospitalized with flu. And just so everyone knows, we have an active surveillance system that goes on. The public isn't always aware of that, and we do the same thing with COVID. We have key areas, sentinel places, we call them, across our community physicians' offices, urgent cares, and the hospitals where we monitor on a regular, like a daily basis, what's happening to inform us if we need to take action sooner. All those measures are in place, and we certainly will keep the public informed. All right. Thank you all for joining us today. And please take action and become vaccinated and wear your mask when you're in places that are indoors and when you're with individuals not from your same household. And have a safe holiday. Thank you.